Welcome to Case of the Day for May 2023. My name is John Konoski, the Medical Science Liaison for Arbutus Medical, and the goal for this lecture is for us to discover the different ways that skeletal traction can benefit our patients. Today, we will be talking about a 30-ish-year-old male passenger of a motor vehicle accident who was ejected. He had an unknown age. He was hypertensive. He had a GCS of 10 to 11 whenever he first came in. He had a right open skull injury and deformity. He was given fentanyl and became hypotensive into the 60s, deteriorated, ended up getting 2 units of whole blood transfused, was intubated by general surgery trauma team, and responded and was sent to the scanner. Orthopaedically, he had a right acetabular fracture with a hip dislocation and a significant number of very serious other injuries. This is the patient's initial x-ray whenever he came in at 3:36 in the morning. Both of these x-rays are the same. The image on the left that does not have any markings on it is simply to demonstrate a plain x-ray. On the right, I have done what I can to try and demonstrate the high level of comminution that this patient had in the right pelvis. We did manage to get some very good CT 3D recons that show the significant amount of comminution and impaction in this patient's right hemipelvis and acetabulum. The patient was very quickly placed in skeletal traction, and as you can well imagine, they were very busy trying to stabilize all of the other life-threatening injuries that the patient had. This is by 9:30 in the morning after traction had been on for a few hours. We see the image on the left has 15 pounds of traction, and almost immediately after that x-ray was taken, 20 pounds was applied, trying to pull the femoral head out from the impaction that it had sustained during the initial accident. We can see between the 15 pounds and the 20 pounds, there is actually a difference. And again, this is within moments of being applied. So there wasn't a lot of time for muscle relaxation and muscle fatigue. And already we're seeing a difference. Skeletal traction can be very helpful in attempting to keep the hip reduced, keep pressure off of the femoral head, and keep a more natural anatomic alignment prior to the operating room. This patient was very sick and unstable, and 5 days later, he went to the operating room and underwent ORIF with one of our trauma surgeons who did an excellent job of reestablishing the acetabulum and realigning the pelvic ring. Thank you very much for your time. I appreciate any and all feedback. Feel free to ask any questions and contact for more information as needed. Thanks so much.